Well, hello again. I thank you all for being here, and I give Dr. Wennberg the floor so he can welcome us.
Well, thank you, José, and welcome everybody who's listening in on this webinar. And the idea of this webinar is to launch the monitoring exercise that will cover 2021. And we have done this now for quite a few years, and we have had this survey looking at the activities. And it has been very helpful, very important, and we have sort of collected a lot of interesting data based on the activities on the different centers or units and healthcare providers that are in the ERN. This year, we will try to expand the survey a little in that way that we will also, during this webinar, ask people to not only fill in the survey when it comes to the numbers and the figures, but also if they have the possibility to share local clinical practices and activities and these types of things with the rest of the members of the network, it would be very good and very helpful. And we will try to issue an awards when it comes to the centers and the members that do this in the most the best way. And this is the new thing with the survey and the monitoring exercise this year, that we will not only have the figures but also try to focus on specific network activities that are ongoing and share best practice with each other. That will also be very important job for a network like this. Thank you very much.
Thank you, Dr. Wennberg. So, as Dr. Wennberg has mentioned, this is the idea. Well, just some background. As you already may know, I'm one of the representatives of the coordinating center in Hospital La Paz in Madrid. And since I believe, no, Dr. Wennberg, from the very beginning, we have been working in this working group of quality and safety. And as he has mentioned, we have been trying to develop quality standards of care in the background of our network, this pediatric transplantation. And as he also mentioned before, we have been doing this for several years. And well, the key point or the starting point was when all the networks met in November 2018, and they put together a common set of indicators for all the networks. It was then when the first monitoring exercise was launched by the DGSNT, and we started to collect from you, from the full members and later on from the affiliated partners, some of the information that the DGSNT asked for all the networks. As you can see on the slide, of course, there have been some changes, especially in the clarifications that help us put to you what kind of information we need in order to give the European Union. But as you also know, full members and affiliate partners are required to report those activity data. In fact, last year was the first time when they allow us not only to give to send the data to the European Union, but also to give information of how many members of every network is providing this data. As we face now a new phase, you know that very recently we have new full members and all the networks have grown. Well, this is something that we will have to keep putting forward, not to help all the hospitals to understand why we need this data and what can we do all together with this information that will help us to improve. As you see in the slide, all these exercises are part of a wider integrated system that include not only monitoring but also the initial assessment that you have been going through in order to become a member of the networks, but also the evaluation. And of course, the idea of all this is to get that information in order to put into action some quality improvement measures. because the idea, as the European Union has shown us, is that we have to get the information from the networks, the areas where we have succeeded and where we have not. And well, we have to show what added value do the networks provide in our settings, not only, as you know, in our local settings or national settings, but on the European level. Well, just to point out these monitoring exercises, of course, we have an important role from the coordinated centers in order to disseminate this information to you and to collect the data from you, but especially those data that is related to the activity, the different activity that every network provide. Well, those are you, the healthcare providers, who have the access to that information and that can give us that information. Of course, also patient representatives and member states will have a bigger role in the future, and in this quality improvement system that we talked before, it will get in the future, they will have a bigger role, and they will also provide data in these monitoring exercises in the near future. As you can see, this is the last update definition of the core indicators that once more we are using in order to give you examples and data of what kind of information we need. And you have them available in the website of the European Union. And well, that's the idea. Now, this year, we won't change the definition of the indicators, although we have changed some parts of the survey we use in order to collect that data from you. We will go through that in a moment. But the indicators are still the same as those that were defined in 2018. Well, in fact, the idea is that very recently the European Union has decided to do these monitoring exercises once a year. For example, last year we did it midterm, but after checking out that it didn't provide an added value to collect those data at the mid of the year, finally the European Commission has decided to ask for this information once a year. In fact, the idea is, we will see it afterwards, that in March the exercise will be open for all the networks to provide the data, and we are planning to open our survey next week and close it by the 3rd week of March in order to have enough time to collect the information and to put it to the DGSMT. Just to remember, because you may recognize this from last year midterm survey that we launched in October, I remember, I think September, October. Well, these indicators that we need your help in order to fill up this information are about new patients that are attended in our transplantations programs, the CPMS activity that you know that we are already promoting with your participation, and in order to make it real and to use it as a real tool to improve the healthcare of our patients. We also collect education and training activities, clinical trials or observational prospective studies, or even publications that we have been promoting among our members, and those things we also collect them. And again, another issue is the clinical practice guidelines or the clinical decision-making tools that we have been asking you to share them with us, so we can share it with all of us, and those that we are trying to promote also for our own network. Again, we need also information of what congresses or conferences or meetings you have been sharing the experience of our network. And well, those, as I mentioned, are the classical indicators. But one thing that I will try to focus now is explaining why we need this special indicator, the total number of new patients referred to any healthcare provider participating in the network. because this indicator, as I mentioned before, is a common indicator for all the networks. Perhaps to our network that is focused on pediatric transplantation is not as useful as other indicators may be, but we have to provide this data. So we are asking you not only if you do transplantations, not only of the number of transplants of different type that you have performed during a specific year, but also any patient that you have attended before transplant or after transplant in order to follow up him before adult setting. In fact, well, as you can see, this issue is very important for the DG Santé, and as I mentioned before, I hope that you understand what we are asking you to get, and if not, please do not hesitate to contact us. I don't know, Dr. Wennberg, if you want to explain this further.
Well, no, I think you did it quite well, and so it's not just the transplantations that we are interested in to know about, but also what has been done on patients, evaluating patients for transplantation, and also the follow-up after transplantation.
That's right. Of course, at the beginning, when we were assessed in order to get into the network, the easiest, the more accessible data we had was the transplantations, but we have to keep in mind that our scope includes not only transplantation, but pre-transplantation and post-transplantation. And specifically in the pediatric setting, that is something that we want to focus, not only again about the numbers, but about other indicators that we know it shows that we have quality of care involving those children.
Yes, you're right, José. So I think this is equally important as the number of actual operations and transplantations, because I mean, as we all know, that it's as important to have a good activity before, to evaluate patients, and also to follow them in a proper way. So to show the whole impact of the transplantation activities, we need to look in a broader perspective.
That's the idea, and of course, in this, after we have finished the first 5 years of the network, well, we have to get to that point, because we think that's the point where we could give extra value, of the things that we are doing as a network, So just to show you in a scheme that we shared last board of the network in Seville, this is the idea. We have to have an overall view of the transplantation program. We, of course, we think that the number of transplant is important, but as Dr. Wennberg mentioned, we have to keep in mind all the things that we do with the patients, and especially those things we do that improve their quality of life and their outcomes. So that's the general idea. In fact, what the European Commission is asking us is this part of this scheme. It's only asking us which patients are entering our programs, but we want to focus on all the possible indicators that will help us improve as a network centered in pediatric transplantation our processes. So that's the idea, and of course we will repeat it as many times as needed. Dr. Wennberg, please.
No, this is important to show the whole activity of the network, and this is important to show to the European Commission, because if we want to have a prolongation of the funding, for example, we need to really show the importance of the network, and not only the transplantation procedures. We need to show the whole scope of a transplantation program and transplantation activity.
That's it. That's the idea, and as mentioned, well, we have some work ahead to get to that. Well, in fact, in order to give some examples, only some of them, we did some work of this at the beginning of the network, when we tried to establish some indicators that were specific to our network. But of course, we are interested in the different type of transplantation programs that you are handling in your centers. Of course, we have already mentioned it, the number of transplantations performed, the mean hospital stay for transplanted patients in those that are needed, the number of visits in outpatient setting, the number of patients attended in outpatient setting, or even, as I mentioned before, perhaps the most interesting number for us as a network is the total number of patients that are active in the program, no matter they are being followed up or not, but that until they reach the adult setting are in charge of us, and that we are somehow following the care and and providing the care to them, no matter if we see them in the outpatient setting or not. Of course, other issues that we are worried and that show quality of care is readmission and other complication rates. And again, another issue that we know it's very important for transplantation programs, that is the survival rate. In solid organ transplantation, graft survival rate and patient survival rate, and in hematopoietic stem cell transplantation, the disease-free survival rate. And again, of course, we can have other indicators for our network, independent from those that are suggested by the DG-SANTE. And for this year, we are planning to ask you 3 issues that we think could be information that we can value, that we can share together. For example, if you develop fellowships in transplantation or educational exchange programs, if you are participating somehow in transplant-related research consortiums, you know that one of the working groups of the network is promoting research, and we would gladly get that in. We would like to get this information in order to see if we can get further in that working group. And again, something that it will be different, we guess, from some country to other, especially because of the differences now in the accreditation and in the referrals from every country. We also are interested to get what kind of quality certifications or accreditations you have taken for your programs. I don't know if Dr. Wennberg, if you want to add something about these specific indicators.
Well, no, I think it's okay.
Perfect. So going forward, well, about the survey, this is the survey that we want to launch next week to all of you. As you can see, it's a full year survey for 2021. We expect you to give some information of the representative that is filling up the survey. As you know, we are interested to have a person in every center who collects the information for all the transplantation programs that are being undertaken in that center. You will have to specify if you are a full member or affiliated partner. And in case you are an affiliated partner, we also will ask you if you perform or do not perform surgeries, do not perform transplantations, because in case you're an affiliated partner and you don't perform transplantations, we will ask from you only a bit, I mean, not the whole survey, but some parts of it. We will ask for transplant programs, in case you do combined transplantations, what are those, outpatient cares, and ERN activities. We will go through that in the next slides. As you see, this is the 4th annual survey. We aim to collect from you the full year transplantation activity. As I mentioned, we are also interested, because the DG-SANTE asked for us to get the number of new patients included in transplantation programs. I mean, not only those that have been transplanted, but those that have been attended by your hospital in that specific transplantation program, or even before or after transplantation, although you have not maybe done the transplantation procedure. The total number of patients active in the programs, we know it's something that in some cases or in some hospitals it will be not easy, but we would like to know what is the total number of patients that are being handled in every program, in every center. Again, if you have data about your survival outcomes, we will ask for you for those data. And we will also ask for you about those additional activities that are being collected by the DG-SANTE. As you know, in the technical secretariat here at Hospital La Paz in Madrid, we have a lot of information, but probably you have some local activities that you can share with us that are related to TransplantChild or pediatric transplantation, and who who acknowledge the network. So we will be very gladly welcome that information, because as I mentioned, that information is the information that now the DG Santé is measuring. We will also ask for you to get other information, other interest, other indicator of interest that I mentioned before. Well, that is the general idea. We are just trying to fix some things in the survey, but we will hope to launch it next week. The idea is that for all the full members and affiliated partners to complete the survey between next Monday and Monday, March the 21st, of course, 2022. If possible, because that's something that the DG Santé will also ask from us. If you share with us some data or some experience, we need to have that evidence from that. So you can have it on your own website of your healthcare provider, or you can give it to us, and we can publish it in TransplantChild website. As I mentioned before, from now on, the monitoring exercise will be carried only on annual basis. In this month of March, as I mentioned, we hope to have the last week of March in order to get the data you have sent to us and put it together to send it to the DG Santé. And as I mentioned before, of course, we will do some activities to help you, to show you how to fill this data. Please don't hesitate to contact the technical secretariat or us. But we need your participation, because if you're not able to participate, well, our network won't function for its purpose. And you may remember this from previous exercises. We will try to validate the data internally, because we have information from you, not only when you join the network, but from previous surveys. So if we see something that you have sent in last year's survey that doesn't match what the activity information we have from previous year, we will ask you in order to validate it. And of course, we will undertake some specific validation activities, either by webinars or in our part of the network meetings, as we did some other time, in order to validate externally the data directly from you. And just to finish, as Dr. Wennberg said before, we want to give more reasons to fill the survey. And we think that during this year, we can prepare, and the TransplantChild Executive Operating Committee is planning to do it, to prepare a call. So from the information you have been sending to us, or other that you may send, or we will collect from the other activities of the network, we will try to give some awards, some recognition in those fields that you have on the slide. Dr. Wennberg, I don't know if you want to add something about this, about the work.
No, I think this is quite important point, and I think it's an improvement in the evaluation of the network impact, because I mean it's not just numbers; it's also the other activities that are ongoing on in the different healthcare provider centers that is connected to the network activity. I mean, there are. I'm sure that the future and the success of our network is really depending on the activity the activities in the different centers, and that we really are able to pick them up and to show them and to report them to the European Commission, to the DG Santé. So I think it's very important to encourage everybody to share for example, best practices and successful treatment protocols or similar things that we are doing locally, and to share them with the other in the ERN. Because this is really important, and collaboration and to learn from each other and to share best practices is really important. I could, for example, here at Karolinska, we are working a lot with transition, for example, and I think that it would be very interesting for us to report these activities and to share them with the other members of the network. Or it could be sort of issues that are related to health-related quality of life, for example, in our patients. And these things that are not really in the survey at this time point, but that is really important for the patients and that improves quality in the activities that we are doing. I think we should share them with each other, and this is the idea here with this awards thing is to really encourage people to do that.
Yes, that's the idea. It's still, as you can see, an open idea. We welcome any ideas that you think can help us encourage people to share experiences, so we can promote best practices and recognize them from the network. That's the idea, and of course the survey, other input that we are getting from you. Well, we will try to put it forward and to focus on these specific objectives for this new year. So yes,
CPMS participation is really important here, because that is a key factor with the network. I mean, we should really create new panels and also collaborate and work within the panels to help each other with difficult clinical issues. I think that is really important. And another possibility that we could use more, I think, is to do our own webinars, and this is a very good way to share activities that are done locally with the rest of the network. And I think if you want to create your own webinar, that you could have help from La Paz, I guess, with that.
That's right. That's right. As you can see, although we have been functioning 5 years, we still have a lot of things to share. So it's open to us, to our initiative and motivation. And hopefully in this new period, we will get some extra motivation regarding the funding. So yes. That's the idea. If we show the European Union that we get extra value, we will get fund for that. So that's the idea.
Very important. We need to show really that we are doing good things. We need to share them with each other, and we need to sort of report them within the network. Then the European community will see that, and they will trust us with future funding. I think that is very important.
That's the general idea. Yes, I agree. Well, just a brief summary in order to finish this part of the webinar, but we hope that you would like to participate when we finish. Is just, as I mentioned, from now on, the monitoring exercise will be carried on an annual basis. That keeps the importance that at least once a year, we have to focus on the things we have done locally, and globally as a network, thinking of the whole previous year. In this fourth annual survey, we will collect all the activity from last year, including, as we mentioned, new patients, total number of patient active, survival outcomes, and other additional activities that can show the work of the network. And well, one of the obligations is to provide the network coordination team the results of your center. We depend on the representative of every member of the network to collect and to connect the different transplantation programs that you are developing, and to gather this information and to provide us this information. And as mentioned, we will try to develop during 2022 some kind of outcome awards in order to motivate us, so we can find more reasons now to share our results and best practices. That's the idea. If we do it, of course, it will be easier.
And I think that it's not necessarily that we ask everybody to do new things and invent new things and to develop new methods, but I am confident that in all the centers that are participating, there are very good activities already ongoing today that could be very important to share with the rest of the members.
That's right. That's right. Of course, it's new for the network, but probably it's not new for you. So we would be very, very grateful if you focus also on that. And just to finish the last slide, well, just some call to action. Of course, there's an open mind from us in order to work and make it easier to complete the survey. Please, if you have problems, contact us from the technical secretariat to us. We will, of course, help you in order to fill it and to get that information that you want to share with us. Of course, although we can ask for a lot of things in the survey, we need still a minimum activity report that it will be, as I mentioned before, the new patients and the transplantations that you may have performed last year. Of course, please share with your colleagues that we will start very soon, hopefully next week, to collect this information. And of course, if you send us information, please have some evidence of the things that you are sending to us. And if we want to effectively provide added value, we have to focus on the most relevant activity indicators. So we are open-minded, and any help and any feedback will be very welcome. So that's the idea. Of course, we have prepared the survey. We think that it can suit for these objectives, but we are open-minded and really accessible to know all your opinions.